Assalamu alaikum friends, my name is Aamir Hayat and today we learn important points about blood. A decrease in RBC count is known as anemia. An increase in RBC count is known as polycythemia. A high concentration of bilirubin in the blood causes jaundice. The disease resistant blood cell WBC leukocytes, which WBC is known as soldier of the body, neutrophils. Largest WBC monocytes. Smallest white blood cell, lymphocytes. Antibodies producing the white blood cell, lymphocytes. Lifespan of white blood cell 10 to 15 days. Blood cell performs an important role in blood clotting, thrombocytes, platelets. Vessel is called thrombus. Anticoagulant present in blood, heparin. A hereditary bleeding disease, hemophilia. Bleeders disease, hemophilia. Christmas disease, hemophilia. A type of anemia with sickle-shaped RBC, sickle cell anemia. Viscosity of blood 4.5 to 5.5. Instrument used to measure hemoglobin, hemoglobinometer. Who demonstrated blood groups? Carl and Steiner. Who demonstrated Rh factor? Carl and Steiner. Blood group which is called universal donor, O. Blood group which is called universal, AB. Blood groups is most common among the Asians, B. Thanks for watching.